Hello everyone, I am Kevlani, Assistant Professor from Department of Pharmacology, LG Institute of Pharmacy. In today's session, we are going to talk about what is pharmacology and various routes of drug administration. Okay, so let's talk about general pharmacology. So very first is pharmacology is science of drugs. Now, pharmacology is made up of two words, pharmakon and logos. Pharmakon means drug and logos means to study, right? So, pharmacology means to study the drug. In broad sense, it deals with interaction of exogenously administered chemical molecules with living system, right? When we administer any chemical, the chemical is a drug, right? That will interact with our body system. Any single chemical substance which can produce a biological response is a drug. So that is definition of drug, or we can also call it that any chemical which can change the physiology of body, that is drug. Moving on, today we are going to talk about the routes of administration of drug. So mainly there are three routes: antral, parenteral and topical route. The very first is antral route. In antral route there is oral, sublingual, buccal and rectal. Very first, oral route. So oral route refers to two methods of administration. Very first is applying topically to the mouth. So let's say ointment, we are applying ointment in the mouth, that is also oral route, right? Or second is swallowing for absorption along with gastrointestinal tract into the systemic circulation. So that is the tablets or capsules or suspension solutions we are taking through our mouth. Now, these chemicals will reach to our GI tract, ultimately in stomach and intestine, and from that it is absorbed. Right. Per oral is the abbreviation used to indicate oral route of medication administration. Right. Sometimes you have seen that in doctor's prescription they write per oral, PO. Right. It is used for oral route of administration. Moving on, advantages of this oral route. So it is convenient, can be self-administered, as well as it is pain-free and easy to take. Second is absorption. So it is absorbed through whole GI tract. Means whenever we take this drug ultimately, so drug will reach to our stomach, so it will be absorbed from stomach. It will also go to the intestine, so it is also absorbed from our intestine. Then after, it is cheap compared to other parenteral routes. Moreover, there are also disadvantages of oral route of drug administration. The very first is sometimes it is inefficient. Only part of drug may be absorbed. So it is not necessary that whole drug that we have given is absorbed through our stomach or intestine. Sometimes it happens that some drug may be remain unabsorbed and it is excreted. There is also first pass effect, that is also known as first pass metabolism of drug. So what happens in first pass metabolism? Whenever we take this drug through oral route, it will reach to our stomach. Now in stomach it is absorbed, and from stomach blood vessels it will reach to liver via portal circulation. Now as we know, liver is a chemical factory, right? It will metabolize some amount of drug, and remaining amount of drug will further go to our systemic circulation to produce its effects, right? So what happens, some amount of drug is metabolized in liver, and that is totally useless for us. So that is known as first pass metabolism. Moving on, there is also irritation to GI mucosa due to this drugs. That is a major disadvantage, and that causes nausea and vomiting, right? Destruction of drug by gastric acid and digestive juice. So sometimes what happens, the drug is degraded in stomach acid. Let's say we cannot take penicillin orally. Why? Because the penicillin is degraded orally in the stomach. Moving on, effect is too slow for emergencies. So suppose we want this drug's action in few minutes, so it is not possible via oral route. right? It takes a minimum 30 minutes to 2 hours to produce its effect, because the drug will go to our stomach. It will first disintegrate, then after it will dissolve in stomach fluid, and then after it is absorbed. So it takes time, right? Next is unpleasant taste of some drugs, and also it is unable to use in inconscious patients, right? So first pass effect, as we were talking about. The first pass effect is term used for hepatic metabolism of pharmacological agent when it is absorbed from the gut and delivers to the liver via portal circulation. So ultimately drug is absorbed from our gut or from our stomach, and via portal circulation it will reach to our liver. The greater the first pass effect, the less the agent will reach to the systemic circulation when the agent is administered orally, right? Moving on, yes, this is the image. You can see here the liver and the GI tract, right? And in between there is portal circulation. Oral dosage forms. So common oral dosage forms are tablet, capsule, liquid, solution, suspension, syrup and elixirs. In this form we take our drugs orally. Moving on, second is sublingual route. So sublingual administration is where the dosage form is placed under the tongue. So in under the tongue there is a huge amount of blood circulation, and which ultimately facilitates our absorption of drug. It is rapid form of absorption ultimately. The advantages of sublingual form are it is economical, quick termination also occurs, first pass is avoided, and drug absorption is quick, right? So the main advantage among this is first pass metabolism is avoided. There are also disadvantages that unpalatable and bitter drugs cannot be taken via this route. Apart from that, there is also irritation of oral mucosa. Large quantities not given via this route, and few drugs are absorbed. So there are very least number of drugs which are absorbed via sublingual route. Moving on, buccal route. So buccal administration is where the dosage form is placed between the gum and inner lining of cheek, that is known as buccal pouch, absorbed by buccal mucosa. So absorption occur by buccal mucosa. So you can see here the drug is placed here in buccal pouch, right? Then after 1 hour it will start to disintegrate and dissolve. Then after 5 hours it will be absorbed, and after 10 hours this is the condition of this tablet. The main disadvantage with this is we cannot keep it for a long. So talking about advantages, so it avoids first pass metabolism, that is prime advantage. Then after there is rapid absorption and drug stability. Disadvantages are it is inconvenient. So it is inconvenient to keep this drug for about 10 hours in buccal cavity. And after, advantages are lost if it is swallowed. So if a drug is swallowed, then there is no advantage. It will degrade in our stomach fluid and ultimately it will bypass. Then after, small dose limit, so we cannot give large doses via this route. Moving on, rectal route. So there are advantages of rectal route and disadvantages of rectal route. So already we know what is rectal route, right? So the drug is given via alimentary canal. At the end of alimentary canal there is rectum, and via rectum these drugs are administered. The advantages are little or no first pass effect, used in children due to vomiting. Ultimately when children uh, ultimately they vomit the drug immediately, right? So to avoid that we can give these drugs to children via rectal route. Disadvantages are it is inconvenient, absorption is slow and erratic, and irritation or inflammation of this rectal mucosa may occur. Moving on, systemic or parenteral. So parenteral, let's just break it down in two words. Parenteral. Par means beyond and enteral means intestine. So beyond intestine. So ultimately parenteral route, or you call it systemic route, in which drug directly enters to our systemic circulation. Systemic circulation is nothing but a blood vessel. So parenteral administration is injection or infusion by means of needle or catheter inserted into the body. The term parenteral comes from the Greek word per means outside and entron means intestine. So this route administration bypasses the alimentary canal. Moving on, systemic parenteral routes or systemic circulation or systemic routes are intravenous, intramuscular, intra-articular, intrathecal, subcutaneous, and intradermal. That is also intra-arterial. Right. Moving on, intravenous route. So in intravenous route, drug is given directly into the systemic circulation, that is our vein, right? So advantages of intravenous route are the bioavailability is 100%, right? Bioavailability is availability of drug in our systemic circulation. So when the drug is directly given into vein, 100% or full amount of drug is available in our systemic circulation. So 100% bioavailability. Desirable blood concentrations are achieved, large quantities can be given, vomiting and diarrhea. In that condition also this drug is given. So what happens when the subject or the patient is having problem of vomiting or diarrhea via oral route, so it can be given to that kind of subjects. Emergency situation can be handled via intravenous route of drug administration. First pass is totally avoided and gastric manipulation is also avoided. There are also several disadvantages of intravenous route. Very first is irritation. Then after thrombophlebitis is inflammation of vein. Right. Repeated injection is not always feasible. It is less safer than any other route because drug is directly entering to our systemic circulation. So when any poisonous material is given, there are chances that it will produce its effect too much fast. So it is less safer. Moving on, the technical assistance is required. Danger of infection, it is expensive and less convenient and painful too. Next is intramuscular route. So in intramuscular route, the drug or injection is given in the muscles, right? So in that, the advantages are absorption. Absorption is reasonably uniform, right? Rapid onset of action is also achieved, and mild irritants can be given via this route. So sometimes what happens when drug is having characteristic of producing irritation, then this kind of drugs cannot be given via intravenous route. So this can be given via intramuscular route. First pass is totally avoided via this route, as we already know it is a parenteral route. So first pass metabolism will not occur via this route, and gastric factors cannot affect in this route. Moving on, the disadvantages. So only up to 10 ml of drug can be given. Local pain and abscess may also occur via this route. It is also expensive and infection may occur, as well as there are chances of nerve damage via this route. Moving on, next is subcutaneous route. So in subcutaneous route, the injection is given in our tissues, right, in the subcutaneous layer, right? So injection under the skin is given, absorption is slow, so action is prolonged. Implants are given via this route. So tablets or porous capsules are implanted in the subcutaneous layer, and then they will release the drug slowly, right? So that is subcutaneous. Next is intradermal. So the drug is given within skin layers. Skin layer, that is dermis. So as we know, dermis is a upper skin layer. So in that the drug is given. It is also painful, right? And mainly used for testing sensitivity to drug. For example, penicillin. So before giving penicillin intramuscularly, it is given intradermal to check its sensitivity, right? So if the patient is sensitive to penicillin, then it is avoided. So next is topical route of drug administration. So topical administration is application of drug directly to the surface of the skin. It includes administration of drug to any mucous membrane, like it is applied on eye, nose, ears, lungs, vagina, urethra, and colon. Moving on, topical dosage forms are cream, ointment, lotions, gel, transdermal patches, disc. The drugs which are applied on eye are in form of solution, suspension, and ointments, and on nose are spray and powder. So that is topical form of drug absorption. The advantages and disadvantages of topical route are: it is local therapeutic effects. So it will produce local effect whenever there is local injury. So it is the most advantageous route for that. Not well absorbed into the deeper layers of the skin or mucous membrane, right? It is not well absorbed to the deeper, and as it is applied on the surface, it is not absorbed into the deeper tissues. The transdermal routes offer steady level of drug in the system, and spray for inhalation through the nose may be for local or systemic effect. So, whenever the spray is applied through nose, ultimately the drug will directly reach to the systemic circulation. So, that is why it is said it is for systemic circulation, right. Moving on, transdermal, so absorption of drug through the skin to the systemic circulation. The advantages are stable blood level, no first pass metabolism, and drug must be potent or patch becomes too large. That is the main criteria for this transdermal route. So the drug should be potent. So if drug is potent, very low amount of drug is required to produce its effect, and if the drug is not potent, then large amount of drug has to be given to produce its effect. So the patch will become larger. Okay, so in this image you can see that there is a layer of skins, various layers of skin. Very first is epidermis, below that there is dermis, then after there is subcutaneous, and lastly there is muscle with vein. So intramuscular injection is given at the angle of 90 directly into the muscles. Then after there is intravenous injection which is given in vein, and lastly there is subcutaneous injection which is given at the angle of 25. An venous injection is given in veins at the angle of 45 degree, right.